And welcome back. Well, breast augmentation is one of the most popular cosmetic procedures, with about 300,000 of them being performed nationally every year. Here to discuss why women choose to have the procedure and some of the options available is Dr. Daniel Butz and Jamie Cook from Quintessa Aesthetic Center. Jamie is the surgical coordinator there as well. Thanks for being here, you guys.
Thanks for having us.
I think the pictures we showed speak for themselves why a lot of women do it, but there's a lot of reasons that women do get breast augmentation, not always just cosmetic. Is that correct?
I mean, most of them are, related to trying to build their self-esteem, have more confidence, allow them to wear the clothes they want to be able to wear, and just kind of feel good about themselves.
I have a lot of friends that have had breast augmentation, some because they didn't feel like they were even, or again, same, they wanted to wear a certain kind of clothing and feel comfortable and confident as well. Who's a good candidate? When someone comes in, they're thinking about doing it, who do you think is a good person?
These are generally 18 years of age or older, healthy, your breasts have finished development, and then you want to increase the size, improve symmetry, and those are kind of the main kind of candidates. Or after breastfeeding, you've lost a lot of volume, you want to restore that volume you've lost.
Is it always an augmentation? Do you do lifts as well?
Yeah, absolutely. There's lifts, reductions. It all kind of depends on what your goals are.
So what are some of the options? If somebody comes in and they're thinking, this is something I'm interested in, I want to know what's available, what are the options when it comes to doing an augmentation?
I mean, the three main options for augmentation are enhancing the breasts, or using silicone, which is by far the most common, saline implants, which there's a newer one on the market that feels a little bit more natural than the traditional saline implants, and using your own fat, which is a little bit more of a subtle enhancement compared to an implant.
So where would you take the fat from?
Wherever you
Anywhere?
don't want it.
Okay. There's a lot of places we don't want it.
Right.
That's very interesting. I didn't know that you could do that as
Yeah,
well. That's
absolutely.
interesting. So when people get this done, I know you're always working with the patients directly as well as the coordinator. What do you hear a lot of women say when they see these before and afters of themselves and they love the way they look? What are you hearing them say?
Well, usually it's just how they look when they come in. They're just beaming from ear to ear. They're just so happy.
Before even? They're just so excited?
Before, obviously they're a little bit nervous.
Okay.
Especially when you take that first step for a consultation, it's a big deal. You don't know what to expect. You don't know what your options are. So, you do get a lot of information that, at the consultation, but afterwards, people are just beaming ear to ear, like, why didn't I do this sooner? I'm so happy with my results. And then, then sometimes it is kind of hard to look at those befores because you have such great results.
Yeah, I bet they feel like you changed their life in a lot of ways. Yeah. That's very cool. What's the recovery time like? If somebody's considering now doing it, or even in the fall or whatnot, when is a good time?
Really any time. And the recovery, the early kind of acute issue, when you're taking pain medications, is 1 to 5 days. I've had some patients just take one pill and they're kind of back to work. But most of the time, I give at least 3 to 4 days to kind of recover, then no real heavy lifting for 2 weeks, and upper body exercising for 6 weeks. And you're just wearing a bra. There's really no bandages or anything like that.
So it's pretty discreet in terms of the bandaging and everything.
Yeah.
So how does somebody begin their journey? What do they do to just start the process?
To get started, you can make an inquiry online, or you can just give us a call at our 1-800 number. We would be happy to set up a consultation to come in and meet with us, try on some sizes, and really get the process started.
So when they come in for a consultation, you say try on sizes. What does that mean?
So we have different sizers based off of the type of results that you're looking for, so that you can get a visual idea. He also has a 3D imaging program that he uses. So it takes a 3D image of someone's body, and then they can actually visually see what the breast may look like after the augmentation. Yes.
That's probably a huge benefit for people.
It's a nice additional tool versus just trying on these different implants in a bra. You can then kind of also see it, how it's going to look as well. So it's good to kind of have multiple different ways of kind of evaluating what your goals are and trying to reach those.
Are different procedures going to leave different scars? Where do you actually do the incisions?
So for most breast augmentations, we use the incision in the fold. It hides very nicely kind of underneath the breast. If you're looking at doing a lift or a reduction, the scarring typically is around the nipple, sometimes vertically down the breast in the fold as well, depending on how much lifting or reduction needs to be done.
Are any procedures, are they less invasive than others when it comes to an augmentation or a lift?
If you're not putting an implant in and disrupting the muscle, just a lift or things like that is a little bit less invasive, I would say, but they're really not all that bad. And just doing fat grafting uses smaller incisions as well, but we always talk about all those different things at the consultation.
Are there, when it comes to like the implants, are there safety issues for any type of implant?
So there's a newer thing out there regarding the texture implants that we've kind of stayed away from. We call breast implant associated anaplastic large cell lymphoma, which is a mouthful. also something I talk extensively about during the consultation process, so you're kind of fully informed about all this. It's extremely rare, 1 in 4,000 to 40,000, and only with those types of implants. So I think it's good to be, get all the information out there, so you're fully informed. And but they haven't shown the other implants haven't shown to be safe and very durable and long lasting.
And that's what I was going to ask. Is this a procedure that you ever have to get updated, or is it typically a lifelong procedure?
If you're having this done when you're 20-some years old, it's likely that you'll need to have some sort of update. The implants themselves are quite durable. They do rupture though, and if they do, you should exchange them. It's not an every 10-year thing though. It's not like a pair of tires or. But if something, as you age, your tissue changes, your breast volume changes. So whether you need a lift or an exchange or something at some point in time to kind of maintain your result is likely.
Well, I think the best thing is to come in and meet with you guys and actually just sit down and talk about what you'd like to see for yourself, what kind of changes you'd like to make, and also that visual, that option to be able to see the 3D of what it would look like is incredible. There's a complimentary breast augmentation consultation being offered right now by Quintessa. If you use the promo, which is myquintessa.com/blend promo, and if you refer a friend, both of you can receive $250 off of the surgery if you move forward. The phone number to make that complimentary consultation is 1-800-499-4309 with Dr. Daniel Butz. Thanks so much for being here, you guys.
Thank you.
Appreciate it.